Hello everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about polycystic kidney disease. So first let us understand what we mean by polycystic kidney disease. So first let us understand the term polycystic kidney disease. Now from this term we can easily understand that this is a kidney disease where there would be several cysts involved, right? The term polycystic means there would be several cysts. So basically in polycystic kidney disease, there would be development of cluster of cysts in the kidney, and that would cause enlargement of the kidney, and also over time there would be loss of function of the kidney. Now how these cysts will be? So first thing you have to remember that these cysts are non-cancerous, and it will be a round sac which will be filled with fluid. And the size of the cyst also vary. It might be small or it might be large, and it can eventually damage the kidneys. So now let us move to the definition of polycystic kidney disease. So polycystic kidney disease is a disorder in which major portion of the renal parenchyma is converted into cysts of varying size. So what is happening here in polycystic kidney disease? The major portion of the renal parenchyma is actually getting converted into cysts, which is a round sac filled with fluid. And these cysts would vary in size. Now let us move to the types of polycystic kidney disease. So we have several types of polycystic kidney disease. So majorly here we have two types of polycystic kidney disease. The first one is autosomal dominant polycystic kidney disease. This is inherited as an autosomal dominant disease, and this is more common in adult. And then the second one is autosomal recessive polycystic kidney disease. Now this is inherited as an autosomal recessive disease, and this is more common in infants. So in our today's discussion, we would primarily focus on autosomal recessive polycystic kidney disease, because we are discussing about polycystic kidney disease in children. Now moving on to the causes. So in causes, the major cause of polycystic kidney disease is considered as a family history. That means if there is any abnormal gene present in either of the parent, that might cause polycystic kidney disease in the children. And rarely it has been seen that if there is any genetic mutation, that can also cause polycystic kidney disease, but it's very rare. So the major cause of polycystic kidney disease, we can say it as family history. So now we know what we mean by polycystic kidney disease and what are the different types of polycystic kidney disease, and also the causes of polycystic kidney disease. So now, as I told you, that we would primarily focus on autosomal recessive polycystic kidney disease. So first, let us understand autosomal recessive polycystic kidney disease in a more detailed way. This autosomal recessive polycystic kidney disease is a spectrum of abnormalities, and in this we can see there would be renal disease, and also along with that there would be hepatic fibrosis. So if the child is presented at birth or in the neonatal period, then renal disease is very predominant. And for those who are diagnosed later in the childhood, for them there would be liver disease along with hepatomegaly and splenomegaly. And also portal hypertension would be present in the child, and along with these things the renal disease would be little bit milder. So if we compare a child who is diagnosed at birth or in the neonatal period, for them the renal disease is more predominant, whereas when it is diagnosed later in the childhood, we can see that this the renal disease is a little bit milder in them. Now the incidence of the cyst increases with the age of the child, and it can be unilateral and bilateral. Now moving on to the clinical features of polycystic kidney disease. So in clinical features, we can see a range of clinical manifestations. Now moving on to the clinical features of polycystic kidney disease. So in clinical features, we can see a range of clinical manifestations in the child, and in that we can see breathing difficulties, because there would be underdeveloped lungs, which would cause severe breathing difficulties soon after the birth. Then there will be abdominal pain. There would be also hematuria, proteinuria, polyuria and hypertension. Now, why hypertension will be there? So when there is polycystic kidney disease, that means there is damage to the kidney and the kidney is not able to function properly, right? So if the kidney is not functioning properly, then we know that there won't be, proper excretion of the waste product, and that would build up in the body, and that would cause increased blood pressure in the child. So that's the reason the child will have hypertension. Also, it can cause intracranial aneurysm. So when there is polycystic kidney disease, this can cause cyst formation in other organs of the body also. So there would be intracranial aneurysms, and then subarachnoid hemorrhage. Nodular hepatomegaly can be seen, and also palpable bilateral flank masses can be present. And if the child is presented in the neonatal period, then we can also see that the child will be having respiratory distress, and this is basically, this results from oligohydramnios. Well, so this was all about the clinical features. Now moving on to the diagnostic measures. So in diagnostic measures, what are the laboratory studies that we need to perform to find out polycystic kidney disease? So they would do serum chemistry profile including calcium and phosphorus. They would also do CBC count from cyst, and there would be urine analysis, urine culture, and also along with that they would do ultrasonography. Well, all these studies would be performed once the baby is delivered. So now the question is whether it can be diagnosed before the delivery or not. So yes, it can be diagnosed. So for that, we can do antenatal ultrasound, and in antenatal ultrasound, if there is, enlarged kidney, especially enlarged echogenic kidneys without visible cyst, if these are seen in third trimester, then this is an indication that there might be polycystic kidney disease. And also there would be oligohydramnios would be evident in this case. Now moving on to the treatment. So in treatment, definitely the first thing would be breathing assistance. So the child will be provided with breathing assistance, as we have seen that in clinical manifestations, the child will have breathing difficulties. And then, we have to manage the hypertension. So for that, we would give antihypertensive. So for that, we can give beta blockers or ACE inhibitors. And then diuretics would be also given. So these things are before the kidney failure. So if kidney failure does occur, then there are mainly two options, that is dialysis and a kidney transplant. Well, now moving on to the nurse's role in taking care of a child with polycystic kidney disease. So firstly, we will be collecting the history of the patient and we will perform our assessment. And after that, we have to monitor their vital signs carefully, especially here the blood pressure. And then we have to monitor the renal function. So how we are going to monitor the renal function? So for that, we have to, continuously monitor the intake and output chart. We have to make sure that the child is hydrated or not. And then we also have to, keep an eye in the urine elimination of the child. Then we are going to monitor the weight of the child daily, and also we're going to assess the edema, and we have to promote the skin integrity. And then if the child is on dialysis, then you also have to assess the site for dialysis. And then you have to provide fluid based on the child's condition. So if the child is having urinary tract infection, for example, then you have to encourage the child to drink more of fluid. And if the child is having renal failure, in that case you have to restrict the fluid consumption. And then you also have to obtain this specimen for urine analysis or urine culture, so that we can find out if there is hematuria or proteinuria, or there is imbalance of fluid and electrolyte. So these things would help us to know the child's condition in a better way. And for that, you have to, obtain the specimen as ordered by the physician. Along with these things, you also have to allow the parents to verbalize their feelings and concerns, especially related to the, progression of the disease and renal failure. And then you have to prepare the child for dialysis or renal replacement therapy as it is indicated. And if any parents have a child with infantile polycystic kidney disease, then in that case, you have to encourage them to go for genetic counseling. So this was all about nurse's role in taking care of a child with polycystic kidney disease. So let us conclude our today's topic here. So today we learned about polycystic kidney disease, where we learned what we mean by polycystic kidney disease and what are the different types, what is the causes, and what are the treatment options available for that. And then what are the nurse's role in taking care of a child with polycystic kidney disease. So I hope you have got a better insight about the topic. Thank you.